No problem.
So the only thing with that is that whatever you record is posted. The meeting-
Automatically?
Not automatically. Yeah, I don't know how much editing they do. I'm here. I'm
Oh,
talking.
so should I
I don't know if we should like.
Sorry, I couldn't make it in person. The roads are too slushy. My van is
Yeah.
down in Medway.
Well, I appreciate you joining by Zoom.
Yeah, there's always Zoom. It's a good thing.
I know, right?
Mhm.
Got your choice.
Mhm.
Option. Go ahead and get started. Look, it's 1:59, but anybody that I'm expecting is actually here. Others have let me know that we're gonna be able to be in attendance. So we can-
Yeah, it's getting nasty out for.
It is getting.
It's got no face over on the windshields.
I liked all that snow, but it stayed put, but now we got the rain, so. I think we'll go ahead and get started. I had sent out, November meeting minutes
I took them.
soon after we had the meeting, so in record time, so I'm hoping you just get the chance to look at them. I didn't hear back from anybody that any edits are needed, so if everybody's good with those, they'll go on record as presented, that you saw them. Very good. And I'm not sure if, John, if you can join us, just the next thing I do have on the agenda, I just wanted to let people know that Community Connections Grant that we applied for, in collaboration with the fire department, the town received $9,607 of funding. And the purpose of that was that we could, fire department could purchase 100 combination CO2 smoke detectors, smoke alarms. Yeah, so when there's a need in homes that don't have to go through the process of applying, there is an option to apply through Red Cross, but usually there's a delay, so we'll have some on site, be able to follow up in homes, and also some of the funding was for some small modifications after doing like a home and life safety check sort of thing. I can stop talking and let you talk about it because you know way more than I do. I'm seeing now that you're on screen, John. Go ahead.
Yeah, so we're excited, that we were able to receive this grant and partner with you guys. So that being said, we're in a place, once we get the okay to purchase the equipment, and once we have the items that we need, we'll be ready to move forward. Our goal is, to go out and install smoke alarms and also do a home safety survey and see, what else, residents might need, if it's, fall prevention items, or they might need an additional smoke alarm. We'll be able to have those tools and resources there, but also to give them that home safety survey, inspection as well. We're just not able to walk into a home and do a home safety survey, so people would have to request that from us. We can offer it as well, but they have to, ask for us to do that. So I'm excited, that we'll have the tools and resources finally here, within the town in-house for us to be able to do that. Right now, we kind of get a request, depending on the urgency of the request. Sometimes we go and make the purchase happen somehow. Other times we reach out to the American Red Cross and wait for them to come in and do a smoke alarm install, which could be a few weeks before we see them, and we give them the name and the number of the resident who's in need of them, and they take care of that. So with us having this resource now, we can eliminate that time frame.
Good. So this would be a good time just to mention that Red Cross is coming to the library and you're collaborating with them. January
Yeah,
30th.
so the Red Cross is going to come do a program late January, right at the library. I apologize, I don't have the date in front of me. But that was after they seen, on social media that we had a couple fires here in Millinocket, small kitchen fires. The executive director of the Bangor office, their Caroline King, reached out and asked if they could come and do a program here in Millinocket. And they're going to talk more than just fire safety. They're going to talk about, winter preparedness, also, you know, some home preparedness as well, for all seasons, but focused, towards fire safety and also winter their preparedness.
I can share the poster with this group afterwards.
Very good. Yeah. And like you, we had discussed, you're gonna be at that presentation as well and.
I am, yeah.
Let folks know that, locally, you have a resource available. So, good.
But would the message to the public be, you know, if you want this home safety check, call the non-emergency fire department number and request it?
Yes, yep.
Anybody with questions on that particular agenda item or, yeah,
Yeah. So we've got guidelines set up for this. We're not gonna be putting these in rental properties.
right,
Senior
yeah,
assisted or senior housing projects.
no, and that was in, the application process to outline that, yeah. Mhm.
Because we're getting a lot of calls right now. Renters looking for,
Oh, it's up to the,
Detectors.
it's up to the.
and we're supposed to have a program in Milan with the Red Cross. We signed a contract with them. But they pulled everything, come up and pulled all the detectors. And that's why they won't give it to me. It's around. Just like, you know, when you buy a house. I just had a gentleman in this morning, bought a property here in Milwaukee. And state law says that they have to sign off saying that there's smoke and carbon dioxide that is in that home. The lawyers are just ignoring them. But I just want to make sure we had that. Yeah, thank you.
Thank you. Welcome, Randy. So, yeah, so the next thing on the agenda, I mentioned it at the last meeting that our transportation grant had wrapped up. We had utilized all the funds. So I created, with the help of Penquist, because they sent me all the data, I've got a report to people, so I can give you a summary of that 16th month of that grant. So, and actually, probably, the last page is a summary page of the 2 graphs, or the 4 graphs, or the 3 graphs that you see on the other pages. So, just as a reminder, Thrive Penobscot, being through the hospital, was able to get a Maine Community Foundation grant for this, we call it Transportation for All. It's actually a continuation of 2 other small grant sources. The first one went to the town of Millinocket. It was a Maine Community Foundation grant as well, to sort of kick this off, but it was in 2020 during COVID and got delayed and late start. And we utilized those funds, and then Thrive Penobscot kicked in some funds until we got this amount of funding, which was over $9,000. And so the data that you see here isn't from the other 2 small grants, but it's just from the one from June 1st to October 31st of this year. You'll see I put the date parameters there. But during that time, there was a total of 122 clients served through Penquist transportation. And just as a reminder too, they have 2 programs. Some of you might remember seeing this flyer. So they have the van and they have the fixed route. And some of you may or may not be familiar with this flyer that we have. And I'll share it because I know some of you didn't, but it's a fixed route. If somebody wants to go to Lincoln, Bangor, but no, they have a fixed route and they have fixed days that they do that. The second part of their general transportation is it's not for consumers to have to know New Freedoms Grant. People could call up and want to go anywhere in Penobscot or Piscataquis County, Monday through Friday, like 7 to 5, and have a self-declared disability, and they would make arrangements for the ride. Thrive Penobscot, the funds paid for the customer fare. So for these 16 months, anybody from Millinocket, East Millinocket, Medway that utilized the general transportation services didn't have to pay. It was free. And like I said, that came to an end October 31st. So, but this data shows that we were able to impact 122 different people utilize the resource over that time period. Most of the people were from Millinocket, followed by East Millinocket, and then Medway. You'll see on that. on the first page. The age group that utilized the resource the most was 50 to 59-year-olds. That was kind of surprising, followed by 20 to 49-year-olds. So that was surprising to me. Also surprising, perhaps not surprising, the most amount of trips. There was like 3,950 trips provided. And when I say trips, that's one way. It's not like down and back or wherever you're going. It's one way. And then another trip would be like wherever you go to your destination if you needed a ride home. Most of the trips, or over 1,000 of the trips, were to the methadone clinic. That served 4 individuals. And we know, I don't say we know, but it's generally people, folks that substance use disorder, you need to go down daily for your methadone. So you can see how that would, utilize a lot of trips, but also, there's a great service. Those folks that needed to use are able to use this funding for that. You'll see that 50 to 59-year-olds had, 1,315 trips, and 20 to 49-year-olds had 1,027 trips. So I have the data here for you just to digest that. But like I said, it was interesting. It's almost like that working age folks. Not that we're not working in our 70s or 60s, but utilize a lot of the transportation services. And so on this graph here, it shows the main trip purpose that utilize most of the trips was to the methadone clinic, followed by work, and then medical appointments for that 50 to 59 age group. So it's some good information here. And then the second most age group that utilized the service was the 20 to 49 age group, methadone clinic, followed by shopping, and then other. And so other categories includes church, restaurant, bus station, town office, that sort of thing. We could bring that. So,
This is very telling.
yeah,
This all wraps back around to what we've been saying here since we started this. We started with the older population of Monarch feels that they don't want somebody to help. We know the numbers are not great, but they want to be self-sufficient. They don't want to have to depend on somebody. And that's what's really telling in this. If you look at the numbers.
as far as not utilizing or those that are transportation dependent.
That makes me wonder how aware they were of the option. I think you're spot on too, though, and this also just shows though how nuanced the need for transportation is, and that it's, across the age spectrum, and
Yeah, so as a reminder, we had 2 different things. Like at first we had this flyer created with Pecos to put this out to say that there's free transportation. The very first grant cycle that we had, it was just really around using the links. It was just, the van. And then we realized it wasn't being utilized that much. And then Pecos had this other New Freedom grant. It's not that the consumer would know, but it was a bucket of funding that they could use that was more flexible. And so the next time we went for a grant, it was like, oh, any of the general transportation was either or, but you can see 96% of the clients used what was the New Freedom. They called up and said, yeah, here's where I need to go. Or, yeah, and that it was scheduled. And they did say that like 67 rides were not able to be fulfilled during that time because they didn't have a driver. So even they couldn't meet the demand of people that needed rides. And I mentioned something else. Yeah, so the New Freedoms, like I said, the New Freedoms grant, very flexible, either county. And on the last page, it's like clients received rides, Millinock, East Millinock, Medway, Grindstone, Woodville, Madawanconnect, Lincoln, Holland, Milford, Orion, Old Town, Indian Island, Bangor, Brewer, Milo, Dover, Fox, and Dexter. So it was both counties. And as far as costs, like when people utilize the van service, and this, it ranges from $1 to $7 one way. When they use the New Freedoms grant, it was like $2.50 one way. So, they kept track of that. And anybody, so, I don't want this, to be not misread or misunderstood. There's probably more people utilizing Penquist for services, because there's those, for medical trips. This was just the general transportation program with the other, Medicare reimbursed trips that were all, medical stuff, so there's more use in this area than just what's captured in this area.
Right, that didn't come under our.
Right, right. And this was sort of a catch-all grant, like if you didn't qualify for other things, sometimes, they would try to plug in people's rides into other funding sources and use this they call it age-friendly funds last. But yeah, it's very interesting. And good, so we have data to go after more points. I mean, there is a need, and then we need to figure out going forward what we're gonna do around this transportation discussion and we.
Is there anything you wanna share about that, like, kind of focus group that happened
That
here
John
and
and I
the
were-
next steps with them, or?
It was John and I were brought, like, and Barbara was, that's right, so Peg was,
Louis and,
yeah,
yeah,
yeah. I'm trying to summarize. Do you remember Barbara? Yeah, so Peg was, we were involved in a grant with them. They're trying to do an assessment of the need and.
There's another workshop on January
second.
2nd at 3:00. I just wrote it down here.
So you're aware of something that I'm not? Is there a follow-up?
Oh, well, I just
So I wasn't at the focus group, that's why I wanted to
Yeah,
ask you
I
guys,
don't know if I got it this morning or yesterday, but it's
okay.
an overview of the service, yeah.
Yeah, what John shared with me was, they did a little focus group to try to better understand some of the needs and barriers regarding transportation here. And, what came out of it was a lot of people living here didn't even know about all the
Yes.
different options available to Penquist. And so, I think, one of several action steps is they are gonna come here and do an info session for the public about all of the different transportation options and have some Penquist staff on hand to talk people through that. I think other actions are necessary, but, yeah, John let me know that that's gonna be on January 2nd. And I'll share a poster with this
Would
group.
that
so
be down here or upstairs?
Probably down here, I would think, but, yeah.
Yeah, I learned a lot at that session. I didn't realize there was options for basically mental health trips, to shopping malls or restaurants. I thought it was all medical basically.
And so it just jogged my memory of what else I want to share. As far as like advertising for this, like initially we had this one poster. And then we had this insert that went in a town mailing. And so as far as, and it talked about, need rides, remember we created this. And so that was pretty much the extent, this was I put it in the link in the comment section, 2 or 3 times. And just up in doctor's offices. So that was the extent of, the advertising, so to speak. And unless you were part of this group and, early on and knew about it. And some of it was because we knew the funding was limited and we didn't want to, didn't want to blow through it, in 2 or 3 months and like to work it out, but at the same time, yeah, it's still, a lot of people aren't aware of
Yeah.
what Penquist.
I still have a question. Forgive me for not getting it completely right. Lynx is, if you don't have main care, you go to Lynx basically. And Lynx has been free because of the grant, but it's still going to continue if you're willing
Yes.
to pay $250, right?
Yes.
Whatever.
Yeah, no, they still have the service, they
Okay.
still provide that, it's just that the customer. has
And
to pay
is there going to be a pending grant for it to be free or is that completely done?
Well, we have to identify a grant to apply for.
Oh, okay.
Yeah.
I think, that, the opioid monies are gonna open up in January. And, application for a transportation grant, would be an excellent proposal for them. The commissioners are getting together, in early January. And we will, flesh out that opioid, monies. And grants will be available and transportation, like to the methadone clinic and stuff like that. I think will be high on their priority list, but.
There was some talk of Penquist putting somebody back up here. Did that go anywhere? Does anybody know? They used to have a
You
representative.
know, we used to have an
In
office.
Milwaukee,
in
and
Milwaukee,
And there had been some talk about that again. Does anybody know if that ever went anywhere? It kind of just died. It was on the radar there for a while, then it just
Yeah.
kind of was gone.
Yeah, that was a
I
while ago.
didn't get anywhere with it,
Yeah.
but I
Okay.
would love to, you know, I still think it's super
It
necessary.
it is
I think we
necessary.
need to keep pushing.
Someone on the
If they
ground.
wanna know, right, if they wanna know what's going on, what Penquist provides.
And that's the, I mean, we can put this stuff out all day long.
Yeah.
But when they have somebody actually here in an office and somebody can go and, oh. Okay,
Yeah, and that was the purpose of bringing somebody up or having somebody come here
Yeah.
for my heap, sign up and stuff and,
Yeah,
yeah.
I guess that's been sort of it's not quite having a staff person here, but like,
Right.
they can at least have their
at
office
least,
hours.
at least some of those.
Yeah.
And maybe ramping that up with other programs that they have, so it's, consistently, if I wanna learn about this Pinkless service, maybe there's a different person here. I'm definitely open to exploring that, we've done it with a lot of different social service groups, but. Besides Liveheap, is there another key Pinkless offering, would it be the transportation that you think
It-
having outreach and having someone here?
My big thing is the transportation. We
Yeah.
need to develop some transportation in this area.
And I think John at the help desk, he knows the most he can, or, you know,
Yeah.
he's up to
Yeah.
date on what they offer, if people call, he's, you know, letting them know.
No, I was just wondering if
Yeah.
anybody heard anything. Had developed out of that.
And I'm wondering, there was a time too, earlier on, the committee, we talked about even, because you do need, there's like a sign up process or a registration process to get in their system, that it wouldn't hurt to get in their system, so when you do need a ride, it's just a matter of a phone call, you're not going through that process, and I'm not sure what the intake process is anymore, so to understand that too, to make it,
Yeah.
so that might be something to even to have an informational session here, yeah, just
Yeah.
might not need it now, but like, you know, come sign up, so when you do need it, you're set, whatever that process is.
Yeah.
And so I found, I know I mentioned it before, and like Barb, you said that you weren't aware of it, and when Penquist was here doing their focus group, they mentioned the links, the service that they have and and their schedule and route, and so I had years ago, and it hasn't changed, Robin went on the website to make sure that the locations and the dollar amounts haven't changed, but I just included like this region to make it easier for readability. It's larger than if you went online and printed off. The Penquist one is just really, really small, so from, you know, from Chester, from Enfield, East Millinocket, Howland, Millinocket, here's where it's scheduled, and they provide rides. And it's just like you have to call, there's 2 business days ahead that you need to call and like reserve your spot in the bus, but these are, Millinocket, every Monday they go to Bangor. And every Thursday they go to Lincoln, and if you just need someplace in Millinocket to go, you have a destination, you wanna go shopping, Tuesdays and Thursdays, they do Millinocket. Millinocket, or
Have a drop off point at these places.
you tell them where you wanna go.
Okay.
Yeah, you call, say, I need to go Lincoln, whether you wanna go to Walmart, Martin's, you know, to eat. Yeah, you tell them where you wanna go, but they'll go to those locations. So, got a few of these, we'll leave them upstairs. at the help desk. Anything else about the transportation stuff before we move on? All good? All good for now?
Send grant ideas.
Yeah.
Jane, I mean, the opioid dollars sound really
Yeah.
promising though, especially with the data that you have now.
Yeah.
Um,
Why don't you
And this was
write
easy.
something up?
Yeah, and this was easy, like to, I say administer, I just had like an MOU with Penquist, and they would invoice. Me the hospital, you know, and I would just forward it on the hospital, through the hospital would. Pay the invoice until paid it down, so.
One of the things too about the opioid grants is we're gonna make them as easy to fill out as possible.
Helpful.
Yeah,
Yeah.
Yeah.
Not a lot of
I
boxes.
can talk to you about that.
Okay. Sure. Good. All right, so Robin, I have you next, yeah, snow down next.
Thanks, so down, geez,
I don't know,
more months.
yeah.
February 16th, the Sunday. That will be snow down. If anybody, I'll probably be having a meeting, well, I will be, the first part of January, right after the holidays. Anyone interested in participating? Let me know. I do want to say that I will not be there that day. So I am gonna need some help. I'll make sure that everything is kind of settled or set up, but I won't be able to participate that day if it's snow down. But I'm not sure if the event committee. Working with Amber, I don't know if she's on there or not.
Recreation committee.
Yes, Cody, I've already sent him an email.
Yeah.
And he and I will be working a little bit just so I can fill him in what goes on. So. I can just put it out to the group when I have a meeting and whoever wants to show up can show up.
Robin, I will absolutely be at that meeting. Sorry that I'm in and out.
Okay, okay, no, that's great.
And Mary had said that she.
Yeah, trustee, yeah, and then I wasn't sure about, I know that Michelle usually, Architecting usually will participate about.
So we'll go back. I know you kept great meeting notes last time
Yeah.
and all that, so we can.
Right, and I'm not sure, well, maybe you can tell me, Tom, now, the Mosquito? Is that gonna be?
We've talked about that, and in fact, I mentioned that to Amber the other day. I guess we just gotta wait and see where we are, you know, as we get closer.
Okay, cause I.
As-
That was gonna be
You know,
part of
if you
snow
remember-
day.
As far as installation's concerned, that will be complete by December. However, as far as the rec department finding staffing and coming up with their emergency action plan, I'm not sure on their timeline. I'd be happy to provide you an update once I have it.
Well, they can certainly use a slide hill.
But if you, yeah, if you remember a few years back, we tried that using the slide hills. And we decided not to, you know,
Promote or advertise.
promote it. It's there if people wanna use it, but we didn't have enough so that we could scatter that far. That's why we chose to do the football field. The track,
Right,
and we'll do that again.
hopefully we'll do that again.
You know, if we can
and
snow.
Hopefully we can get, you know, the library, Cotati Deer Library.
Yeah,
Involved
I would
in
definitely
details.
reach out to Bailey and Dan.
Yep.
That's all snow.
Yeah, and that's the other thing, snow and, yeah,
Frozen
Right.
ice, yeah.
Yeah.
some years it's been nice and then other years it's been so cold. Yeah.
We'll make the best of it, like.
If it gets really cold, I'll bring my solution to make frozen.
Bubble, I saw that.
Oh, that would be awesome. Yeah,
That's very simple.
I'm gonna put that down.
Very
Frozen
good.
bubble.
Bubble king.
But you know, we've done this long enough now, so.
Yeah.
No, it's
Yeah.
pretty much,
Yeah.
yeah, I just gotta make sure, you know, hot
Yeah,
chocolate.
Everybody's, yeah,
Hot dog,
yeah.
fire pit.
Yeah, so, yeah,
Yeah.
The Pelletiers will bump up that fire pit that they had downtown.
well.
no, we don't want that.
That was huge.
That is heavy.
Huge.
They have a second one.
Yeah,
Yeah.
That's when we usually.
Yeah.
that's usually like that one. was
Yeah,
long,
Yeah,
that's a monster. You need a tractor to pick that thing up.
Hey,
so we'll get that going, think that will fall into place, so thank you, Robin, for accepting the assignment. So that moves us on to member updates, so I'll just open up the floor, if anybody wants to give an update, what's going on, and share information, or
I'll get it over with.
you'll get it over with, okay.
There's not much to update. I've redone my flyers. I forget, I'm so personal. I don't give much of myself. So here I am sending out the flyers and I don't have my name on it. So I started to just sign my name with owner of,
Okay,
senior check-in. I've given some to Barbara to help and I've given some to Tom.
okay,
I have a mailing list that I'm getting ready now for the East Millinocket area. And that will go out next week. After that, I'm gonna be holding off because it's Christmas
sure,
and people are busy, but I will be getting that amount out. And I've got some good contacts there. And I'll just keep expanding, going more Aroostook, and then go towards the Lincoln area. And once it catches, that's the thing, get a few people on there. And the lady that had signed up from Princeton gave me another good review saying, I'm so glad I have that. I feel comfortable and safe now. You know, so that's what it's gonna take, is just, once again, I'm not gonna give up, definitely, you know, because it's too much of an interest for me. So I'll just keep plugging away and, you know, appreciate the help from Barb and Tom and others as well. And that's where that stands. I'm done.
You're-
I'm
Give your
done.
update. Thank you, Sue.
I have a little update. Tracy Perry, Beth LaPlante, and I are taking the conflict resolution and other subjects of farmers market workshops, sponsored by the Maine Association of Farmers Markets. Really good so far. It's a total of 6, 2 hours at a time, and we have little breakout sessions. And we don't have enough vendors that have had any major conflict so far, but a lot of good issues are being brought up, including some communities that have very few vendors and some that have 50, you know, so it's a good group of people, and I'm really glad that I'm taking it. And I'll report. I mean, it's gonna be a little different every time, it's every 4 weeks. And another small piece of information that might be useful, I've been helping John a little bit compile a current resource network of simple to use phone numbers and things, and I called 211 as an experiment to see what they would tell me about resources in Millinocket, and she was very, very friendly, and she gave me general assistance at the town of Millinocket extension 5, and turns out that they've changed the extension. It's now extension 2, and it's not called general assistance anymore. They changed the name to welfare, because I spoke with her and she said it looked too general. It didn't really clue into people what it was for, just saying general assistance. So the legal name now is welfare. And is Amber, are you still on the call?
Yes, and I'm sorry, Barbara, that you have that a little backwards. It was previously welfare. It is now general assistance. The reason we do not call it general assistance on the automated line is because people thought that meant general information about the town of Millinocket. That's
Okay.
why it's still labeled as
I
welfare on the
couldn't find
automated.
any, that's really weird, because I was sure that she told me she had changed, the name had been changed to welfare, but okay, it's still general assistance.
Correct.
Okay, how do you find it on the website? I couldn't find it on the town website at all.
I did CC her, or I forwarded your email, and you should be hearing back from Lori Santerre about that. Every department head's in charge of their own page. I can send you the link to it. Absolutely happy to do that, but for further information, I have connected her, and you should be hearing a follow-up.
Okay, I'm just trying to find out, clarify how people would find it if they needed to find
Yeah.
it.
I'll shoot you that link over right now, Barbara.
Thank you.
Okay,
Thank you, Amber.
thank you. I swear she said they had changed it to welfare. That's really odd. Oh, okay. That's
it, okay.
I stand corrected.
I have a few updates. I'll send all this out afterwards, because I know we have some people on Zoom, but Nicole at the library has been working with someone, a graduate student at University of Southern Maine, to do a project to better understand some of the barriers that people are encountering in accessing the resources they need to live well. I know this is stuff that we probably all have an anecdotal sense of and some data about, but we're trying to understand the need on a regional level. So thinking about especially the northern half of the region. This is part of our work with the Katahdin Collaborative. And so it really encompasses from Millinocket all the way up to Island Falls and all the towns in between. So we're doing a survey, one-on-one interviews and focus groups. These are going to be led by this student at University of Southern Maine. She's super nice. Her name is Emily. So we're promoting that now between now and January 17th. And I'm just hoping that you all can be aware of this and spread the word to anyone who might want to participate. If they do the interview, they will get a $10 gift card to Ellis Market. Focus group and survey, they'll be entered to win gift cards. So there is a little bit of an incentive, but hopefully not too much that it's kind of skewing it. And if anyone has questions, there's more information on this flyer that I can pass around the table and send out afterwards. Yeah, so our plan is, you know, with this whole project, it's gonna be it started in September and it'll be wrapping up in May. Is just to really have an up-to-date kind of map of who are the different resources in the region, an updated one, because I know we've done that at various points over time. What are some of the biggest gaps and the barriers that people are encountering when they're trying to access resources? So things like this general assistance, welfare, confusion, you know, that might come up. I suspect it will in several towns, but we'll see what we hear. Even when we already got one. Yep. So that's one update. The target audience for this is like, I guess, affected individuals, people who are actively like maybe trying to access resources versus like community partners. But Emily was also happy to talk to community partners if you're like, I have insights into this is what I'm seeing. Secondly, just related to that, I wanted to mention, again, this is kind of on the regional level, thinking about not just the town of Millinocket, but the Katahdin Collaborative is this cross-sector group of organizations and individuals that's trying to revitalize this region as a whole. And currently, there are 3 major spheres of work. I'll put this in front of the camera. There's sort of outdoor recreation, which is the most fleshed out. Livability, which has a lot of overlap with the age-friendly committee. That's why I wanted to mention it. And economic development. I am currently the facilitator in this sphere of livability, which includes a lot of different things, but our primary projects right now are working on a food council, on LGBTQ inclusion initiatives, and on this resource information and access project that I just mentioned. And lastly, this little worker kind of bubbled up that I wanted to mention, which is around heating insecurity, which I'll get into in a minute. But these are our 4 projects that we're kind of starting out with based on the energy that is there around it, the need, and other factors. So I just want to mention it. I know it's beyond the scope of just the town, but if it's something that you or someone that you know might want to plug into, whether it's wanting to be on this full kind of livability team or on one of those work groups or something else that's in that sphere, let me know. We are hoping to engage more people in that process. Okay, I'm talking a lot, but one more thing. The heating insecurity thing. So you might have seen this poster. It's going to be going out on social media, I believe also in a town newsletter. But one of the projects that came out of this livability group, I'll send this out over email, guys, but is the idea of having a community heating fund. So there's a lot of, there's churches and other small groups that are trying to gather funds and help people in their own silos, which is great, but we were wondering if there was a way that we could combine efforts and connect people to heating assistance in a more unified way. The library had been doing that with limited time grant funds, but now that those are up, we were looking for another organization to take this on, and there wasn't a clear option because there's not one agency focused on basic needs in this region, and it's a huge issue. But anyway, Katahdin, I was hoping Michelle would talk about this, but Katahdin has graciously agreed to be a fiscal host to hold any funds that we are able to raise, whether it's through fundraising, grant writing, et cetera, that could go towards individuals for heating assistance. They're willing to hold those funds, and the system that we're working out is working directly with the heating companies, the fuel companies, to provide that aid, because they have their own records of who's gotten assistance, who's in need, et cetera. So the idea is that Katahdin will hold those funds and distribute them evenly among Preble Oil, Dead River, and Bragdon Energy to start. So starting with the Tri-Town area and hopefully eventually the whole region. So I wanted you all to be aware, at this point, we're just trying to spread the word about raising funds to put in this account. But it's just one of the biggest needs that we see here, and I'm sure that you all see in your work and your experience. And I think it's exciting, so wanted to spread the word about that.
And that's made its way on social media already. I know that's been launched and that's been posted.
If anyone's asking now, like, I need help with heating assistance, we don't yet have, funds
Yes.
to do this. It's just we're trying to start raising the funds and writing grants collectively to have a bigger pot to work from. But how it'll work is they'll call their heating field provider directly to get access to the funds, eliminating kind of a middleman that would have to take those calls.
Are there any specific parameters?
Yes, so what was it? 100 gallons per year per household. And it's supposed to be as an emergency service, so they should be accessing Penquist and those other available funds first.
Will the companies be able to make recommendations to this?
That's the hope. I think most of them are pretty aware because they often are dealing with people in crisis.
Right.
But John here is also working on a one-pager that's explaining all of the available heating assistance options and kind of the suggested order of operation of go here first. If they're out, go here, that sort of
Yep.
process, so that we can all be on the same page about that.
Any other questions about that? Good.
But you don't realize how much work goes into things, just listening to you, that's a lot of
That's a
work
lot,
to-
yeah.
To get together, to coordinate, organize. You all do good work.
Thanks.
Labor of love, right?
It's exciting though,
It
we're
is,
building
yeah.
hopefully a
Yeah.
system that can work better, and the only problem is now we have to find some funds, but
Yeah.
I think we can do that, and
Yeah, I mean, we realized the need, and we had funds from the town for a while, so the opera funds that was like $50,000, and we've gone through those. And so now there's no more reserve of that, so now we need to build that back up and try to. And we know Penquist, their heating oil fund isn't as large as it has been in the past, so they have less to give out as well, so. Yeah, we're working, what we can in the grassroots to make, and impacting systems, right? So it's really great. I know Michelle went out to all the, I don't know if she's the one that talked to some of all the oil companies to create this system, and they'll do their record keeping when they have a system in place as far as.
I'll be sure to share that one pager about the heating insecurity,
Yeah.
order of operations. with you all. Flow chart, which
Yeah.
was
Flow
a
chart.
recommendation of Barbara, so
Yeah.
thank you for that. And, I had one more thing related to that. Oh, but if you're encountering people in the short term that are in need of heating assistance, they should apply for Penquist. They should, they can call Herschel. He did receive some additional funds this year, from Salvation Army, so he does have some funding now. And then general assistance is supposed to be the last resort, that they can go and ask for general assistance.
And that needs a monthly application. But she said they have money and they're open Monday through Friday now too, which is great. That's good. And
That's a one-time factor, that's,
So they what?
oh, yeah.
I thought you could reapply each month.
What's that, Tom?
Let's just change the
Heating assistance.
heating system.
Oh, okay.
Oh, general assistance.
Yeah, right, yeah, do generous.
Yeah, okay.
Okay.
Any other updates?
As we're supporting the heating fund, do you think there's be any way to actually, besides just provide the heat for them, to enable them in some way to prevent them from becoming heat insufficient? I mean, it would go, it'd be a whole nother project, but, for giving them heat assistance is probably why they need it. And maybe there's some way that we could help. Maybe they'll go of the programs and stuff, or general assistance or whatever.
Yeah,
I don't know.
I think part of it is what is the root of poverty in the
Yeah.
first place?
Yeah.
Part of it's probably the information, making sure they have that. For other preventative programs, we're hoping that we do have a date on the calendar to get Efficiency Maine here to talk about the rebates they have for things like insulation and other things. But yeah, I'm open to anyone's ideas about prevention.
You know, maybe part of the problem is that, you know, they have a very under insulated house or whatever, and then,
Yeah.
you know, Efficiency Maine could come in to, you know, they don't know about those programs. But yeah,
That'll be March 6th. We'll have a poster soon, the Efficiency Maine info session.
Any other updates? I will share, I did get an email from Kate Blackstone, remember she worked with us, in the past from the Maine Council on Aging, the Undash project, and she has, in her job now, with this Medicare savings program, there's some new updated information, that she wanted to make sure. She said the income levels have increased as of July this year, and there's no longer an asset test. These changes make it possible for thousands of additional older Mainers on Medicare to save money on premiums, copays, prescription medications, and deductibles. And so she just wanted to make sure we have this flyer, so I can send it out. So I've got something. So there's another resource. So, yeah. Yeah. So, I'm looking at the screen. Anybody? Everybody good? Everybody know? Everybody shaking their head no. Okay, no other updates. So here we are in December. So our next age-friendly meeting could potentially be January 14th if we follow the schedule that we are now. Is that okay for folks? We'll ask Diana first. I think you're probably checking the room availability. Yeah. Yeah, it's available. All right, so I will put a meeting notice and save the date for January 14th and wish everybody a Merry Christmas,
Yeah,
Happy
it's Merry
Holidays.
Christmas.
Let's bring
Happy holidays, everybody.
Happy holidays, yeah, yeah. If they bring on the snow and stop the rain, so we'll meeting adjourned at 2:46. Thank you, everybody.
Have something if you
Thank
want.
you.
I have an empty box.